But I think the one thing that we shouldn't do is that once the review group give the report, that's written in stone. And I think that's the important thing. Thank you very much.
Thank you, Senator Brooke. Senator van Turnhout.
Thank you very much, and I too would like to thank Senator Maloney for initiating the debate this evening and the leader for giving the time today, and I think I join with others in although questioning the process and the way we're doing it. The fact that there is no minister, the fact that there are no officials is very disappointing, and I do need to note that. I am happy that the working group will be meeting shortly, and I think under the chairmanship of Silda Langford, I've no doubt that they will take into account what we have to say. I had the pleasure of working quite a lot with Silda Langford in her role when she was Director General of the Office of the Minister for Children, so I have faith there. The two relevant schemes I just want to touch on is obviously the mobility allowance, but also the motorised transport grant. There's 5,000 people with disabilities in receipt of the two schemes. That's 4,700 who receive the mobility allowance and 300 the motorised transport grant. And as we know, the scheme's closed as of the 26th of February, and a new legally compliant scheme will be devised over the next 4 months, which is now actually 3 months. And we know that the money has been ring-fenced. The 10.6 million has been ring-fenced. So if we look at the mobility allowance, this is a means-tested monthly payment by the HSE. At the highest rate, it's €208.50 per month. At the lowest rate, €104.25. That's what we're talking about. It's for people with severe physical disabilities who are unable to walk or use public transport and who would benefit from a change in surroundings, i.e. it's for transport needs currently unvouched occasional taxi journeys. The Department of Health anticipated that revising the scheme to bring it into compliance, that is to remove the upper age limit, would translate to an added cost of €100 million per annum for the mobility allowance and €200 million over a 3-year period for the motorised transport grant, not to mention the large indirect administrative costs to and burden on the HSE. These estimations, in my opinion, are outlandish. The eligibility criteria is very strict. How many disabled people over the age of 66 are unable to walk, even with the use of artificial limbs or any other suitable aids, or your health is such that the exertion required to walk would be dangerous, not to mention the other requirements. And I did a calculation on the estimation from the department. They anticipate that there would be therefore an extra 39,968 applicants if they were to allow the upper limit. Can we just note that in 2012, 43 people over the age of 66 applied and were rejected. Nothing near the 39,968. So I really do question the figures. The eligibility criteria is very strict, and I just want to put it on the record. 1, you have to be unable to walk even with the use of artificial limbs or any other suitable aids, or your health is such that the exertion required to walk would be dangerous. The inability to walk must be likely to last for at least a year. You must not be medically forbidden to move. You must be in a position to benefit from a change in surroundings. You must be living at home or in a long-term institution. And you must pass a means test. The decision on whether or not you meet the medical criteria is made by the HSE, the Senior Area Medical Officer for your area. So I really do question the Department of Health figures and estimations that they have put forward. And if we look at the motorised transport grant, it's 200 million over 3 years, they're saying. The Department of Health estimates that 19,000 older people over 66 would apply. This grant is aimed at assisting people to access employment. How did the department arrive at that figure? There's going to be 19,000 extra. It's about accessing employment. Maybe they know something I don't know. So my concerns are that there are so many outstanding questions and so much insecurity and uncertainty for those who are still in receipt of the grant but have been told that their payments will cease on the 26th of June. What if the alternative scheme is not ready to be rolled out? In devising the alternative scheme, will the disability sector and the recipients of the allowance be consulted to ensure personal choice and autonomy in terms of the applicable transport services is preserved? We talk about personal budgets, money following the patient, maximising independence, but I'm concerned that this new scheme will in effect remove or diminish personal choice. What is safe and appropriate for one is not safe and appropriate for all. For example, a community transport service is not safe and appropriate for a person with severe autism. Furthermore, community transport schemes are not always the most cost-effective choice. If you look, for example, at two of the providers here in Dublin, we have Fantastic servicing the north side and Act servicing the south side. They charge a higher price and mileage rate, which is the same as a private taxi, and they only operate between 7 a.m. and 10 p.m. with limited number of choices. And Senator Maloney very much raised the issue of rural areas, which equally will have challenges. So I question, has the department or will the working group examine, for example, adding a mobility component to the disability allowance and the supplementary welfare allowance? Instead, giving the means tested associated with these benefits, I'd suggest that that would keep the expenditure within budget. I do very much question the figures that have been put out by the Department of Health, and I would ask for clarity. And I also do ask, why did it happen overnight? Anybody who's gone on management training or leadership courses are told, if you want to be in leadership, you don't come with a problem if you don't know what the solution is. And they really should know the solution. It wasn't something that happened overnight. We've known for a long time. And so for me, it's unacceptable. This is a spreadsheet decision when really it should be about people.
Thank you. Senator Clardy.
no Aristotle, no Hefigi Levegation. I don't see any reason why we wouldn't sit on a Thursday evening for debates like this, but we should have ministers in here to listen to this debate. But I also then say to myself, would it make a difference? Because myself and Senator O'Keefe have sat on the Public Service Oversight and Petitions Committee that have debated this issue with the department officials. And I think the only term that could be used to explain or to describe the type of reception we got